My name is Casey. I'm an audiologist with UofL. I've been with the group for about 3.5 years. I see not only adults, but I see children as well. So our group sees little bitties all the way up to geriatrics. And so we actually have a partnership with all of UofL. So the pediatric group, we see a lot of people in treatment at Brown Cancer Center. We monitor them for changes in hearing if chemotherapy or radiation may affect the hearing, as well as work with our geriatrics group. So really today, what I want to talk about is just general changes that happen when we age and how to be aware and kind of take charge of those changes before they take charge of us. So like I said, what we're going to do is discuss how we hear and process sound. We're going to we're going to review balance and risk factors for falling. We're going to talk about managing our changes in hearing and balance, as well as making smart choices about those changes. Okay, so have any of you ever been in a situation where you can maybe hear but not understand? There might be multiple speakers, and you're really relying on contextual cues or what you see to kind of help you along with the conversation. So are there people in general that you have more trouble with than others? I'm going to assume children and women. So do you often hear but not always understand what people are saying? Yeah. And those are pretty normal, and those are typically some of the first things that we see, or the first thing that you may notice as we start to age. So hearing, we hear with 2 ears and 1 brain. We need the actual organ of hearing to collect the sound and the brain to actually make sense of it. And everybody's listening experience kind of shape how we appreciate sound. So somebody may love classical music, but the next person that comes behind him loves rock and roll and hates classical music. Let's say you get into the elevator with somebody who has on really floral perfume and you're like, woo, that stinks. And the next person that comes in loves it. And so those experiences kind of shape how we appreciate and love sound. I've got a little demonstration that basically shows you quickly how we hear. So this little guy on the end is actually the earlobe. This little piece right here is the ear canal, and this little snail-shaped structure is actually the organ for hearing called the cochlea. And then as it collects sound, it ends up processing that information to the brain. So this little demonstration will show you when sound comes in, that little yellow. It hits the eardrum, which vibrates, goes to the snail-shaped structure, and then up to the brain for hearing and decoding of sound. All right, so when we think about hearing, a lot of people try to compare it to vision. And so if you think about this sentence, the quick brown fox jumps over the lazy dog, we're all able to hear and understand that well. But when you think about it in terms of visual impairment, people typically know, oh, well, I know that I can't see up close or I can't see far away. And those changes are very predictable, and so it's easier to manage those type of changes. So if we look at the Snellen chart with vision, we see that I know that I can see the A at the very top of the chart, but then as the lettering gets smaller, I have more difficulty and may need some sort of visual correction to help with that. But hearing loss is very different. Instead of being able to predict what speech sounds we can't hear, hearing loss is very different than that. It's a very unpredictable path because speech can go in one direction and then somebody says a comment and the speech path will go in a totally different direction. And so that's what makes it a little bit more difficult to kind of follow along with conversation. And that's why hearing loss tends to be more of an invisible difficulty. So as we just demonstrated, we know that hearing difficulties may not be clearly understood, just like just like vision, just because we're using other cues to help fill in what we don't hear. So we're using our vision and we're also using contextual cues. As we age, certain structures change in the blood supply, the way that the sound is conducted, and also changes in the brain may shape how we hear and appreciate sound as well. And usually those sounds or those changes are gradual, so you might not notice it. It's not usually an overnight thing. And so that's why usually it takes 7 to 10 years for someone with hearing loss to actually do something about it. Hearing difficulty is a health issue. I know that now in the marketplace you might get a flyer every day that says, oh, we can sell you hearing aids for $299. Hearing devices are not like refrigerator magnets. It's a health issue, not a product. You shouldn't be able to go into a Walmart or a Costco and be able to purchase hearing devices. It's a medical issue. It needs to be treated by a medical professional. Every year there is a council that meets about healthy aging and things that we can do to prevent issues with aging down the road. And one of the key components that this National Council on Aging found was that hearing and maintaining the ability to hear with others is a huge component to healthy aging. And they also talk about in that article, they talk about 3 other significant areas of daily function that help us maintain those normal social interactions. Hearing difficulty can impact several areas, and the first one is physical function. The research article discussed that there is an increased risk of falls if people have untreated hearing loss. It's actually 3 to 1. Women are actually more likely to fall, and those falls are typically resulting in a traumatic brain injury. Additionally, people may get tired or bored or decide to quit participating in activities, and women especially are more likely to quit driving. One of the main ones that we see is the psychological effects of these hearing issues. So mainly when someone has hearing difficulty with a group or a crowd, they tend to withdraw. It's usually the first thing that they'll do. So somebody might tell a joke and the person wasn't able to follow their visual cues, or lost the context of the conversation, and everyone's laughing and they're just sitting there. And so that leads to feelings of embarrassment and humiliation. And so unfortunately we see a lot of times those seniors that actually are not that are hearing impaired, that are not amplified, actually end up with depression and some of those other kind of psychological effects. So interestingly, untreated hearing difficulties can also lead to cognitive decline. This article specifically discussed reducing gray matter in the brain, which is basically the relay center for all of our senses and our perceptions. And then they did a large study. I believe there were 639 people that they followed over a 10-year period, and the people that were diagnosed with hearing loss and were left untreated were more likely to have dementia. Okay, so now what do you do to manage or identify those changes in your hearing? So really the easiest and simplest way is to have a hearing test. And typically adults at 50 years of age or older, you should have a hearing test once every year or 2 years. And once the audiologist or the hearing care professional establishes a baseline in your hearing, then it may be further down, might be 5 years or so down the road that you need another hearing test. But at least will give us a baseline as to what your daily communication abilities are. So. Okay, so if we identify that you might have some risk factors for hearing loss that can cause some of these issues down the road, we try to kind of hit that off at the pass before it causes any of these other sort of physical issues. There's a great website at the bottom. It's called identifythesigns.org, and every year there's a campaign by this national audiology group that basically just tries to raise awareness about hearing loss and speech loss. Just because those two kind of things can go hand in hand, especially if you're a little kiddo, but they can also develop after somebody may have had a stroke and may have hearing loss and speech difficulties as a result of that. So that website, basically you go in and you can type in your symptoms, and that will show you if you are at risk for hearing loss or speech development issues, and it's quite fantastic. Okay, so does anybody have any questions about hearing before we move on to talking about falls and fall risk? Okay. All right, so we're going to briefly touch on reducing your risk for falls. So falls are very, very prevalent in the aging community. 50% of adults age 65 or older are going to fall at least once in their lifetime. And unfortunately, a lot of those people that do fall will end up with a traumatic brain injury as a result of that fall. There's several different factors for falling. You can have intrinsic factors, which are internal factors, or you can have extrinsic factors, which are environmental factors. Some of the main factors that we see for falling intrinsically are number of prescriptions. So we see a lot of adults that come in that might be on 10 or 11 prescription medications. And research suggests that after you're on 4 or more, you are at a risk for falls, a higher risk for falls relative to those that do not take more than 4. Vision loss, untreated vision loss, untreated hearing loss, and diabetes, just because a lot of the people do have peripheral neuropathy to where they can't always feel and tell where they're placing their feet, or they may have some tingling or numbness in their feet. And also people with either low or high blood pressure. Extrinsic factors, or these environmental factors, are mainly things around your house. So uneven surfaces, poor lighting, cluttered space, and then just rapid changes in your environment, especially if you're unfamiliar with the territory. So for instance, let's say we have a snowstorm or an ice storm. You're not always able to predict those sudden changes that happen with those environmental changes. Okay, so how do you think we can reduce these environmental factors for falls if you were in this room? So for me, I'm looking at the rug. We don't know if there's any non-slip pad under the rug. It's kind of cluttered and kind of squished together. So what I might do is maybe clear off a better path towards the door. There's also some magazines and some random stuff on the floor. Just make sure all the clutter is nice and tidy. Maybe have like a case where you keep all of those like loose papers. And there's also not any additional lighting. So for most people, you should have an overhead lighting as well as additional lighting to kind of light your way. And also, they have these great night lights that when it's dusk, the night light will come on, and then when it hits dawn, it will turn off. And so you may want to invest in some night lights. They're about $10 or $12, I think, at the grocery. Okay. So in 2005, the CDC came out with a fall reduction checklist. I actually have some of them up here if anybody wants to take it with us. And basically, they had 4 main components to reduce your fall risk. And one of them was begin a regular exercise program. Women after the age of 50 have a loss of calcium, and so they recommend a weight-bearing exercise for you all. You should also have your physician manage your medications, especially if you have take more than 4 medications. Have your vision and hearing checked, and make sure your home is safer. And like I said, you can see the checklist that I've got if you want to take that with you. But basically, it's just saying reduce the clutter in your home, those kind of things that we just reviewed in that last slide. Okay, so now I'm going to move on to making smart decisions about your hearing and balance health care. So the first thing you do if you're concerned about your hearing or balance abilities is consult an audiologist or an ear, nose, and throat specialist. I would definitely avoid the type of retail markets that you might see, which are hearing aid dispensers. They often work off commission compared to educational audiologists or university settings that we aren't. We're here to educate the next round of audiologists. And be really cautious about if people offer you free hearing tests. The only reason that they can offer you a free hearing test is because they're technicians and can't actually diagnose your hearing loss. And so that's kind of how they get away with it. And also hearing aid demonstrations are a sign to run the other direction. Oh, pardon me. Okay, so if you do come in for a hearing consult and you do have hearing loss in one or both of your ears, hearing instruments might be recommended for you. And like we said before, hearing is unique, and not everybody is going to appreciate the same sounds as another, and so we need to make that experience unique and a personal one. It's important to remember that you hear with 2 ears and 1 brain. We want to reduce the effort it takes for you to follow conversation. And each one of us, again, has listening preferences that we need to build into those devices if pursued. We have 5 clinical providers, and we actually have 2 offices downtown, and there's actually 1 out east as well. We see adults to children. Myself and Brittany, my colleague, we actually see most of the kiddos, and then the others are more of an academic faculty, but they're great. We're all in the clinic together, and there's an audiologist for everyone for any type of problem. And these are our locations. And that's it. Can I answer any questions about hearing or balance? Have you guys been into any sort of situations where you notice some difficulty hearing or with your balance? Yeah? Okay. All right. Well, thank you guys. That was short and sweet.